Alright, hi there everyone. In this video, I'm going to give you a few exercises that can help you just reset, reorient yourself in 60 seconds or less. So perhaps you're having a very busy day on the wards, in the operating theatre, in the emergency department, in the clinic. You've just had a really tough encounter. Maybe it was breaking bad news. Maybe it was a code or resuscitation that didn't go as well as you hoped it would. Um, Often we don't have the luxury of taking a long break, especially if we're on a busy clinical service, there are tasks or other patients that we have to see. But is there something that you can do in 60 seconds or less to try to reorient yourself in the moment with the understanding that you will have to address those emotions and that tough encounter later on? But what can we do in the moment to try and get us going? So the first exercise is mindful breathing, where we just find a quiet place. And full disclaimer, it might be the bathroom, it might be an empty clinic room or an empty patient room, it might even have to be at your computer at the nursing station while you're charting, right? To just close your eyes for a few minutes, clear your mind, and focus on your breathing, right? Focus on the air coming in, going out. You can take a couple deep breaths if you want to. I promise you, nobody will judge you. um, if you've just had a difficult encounter, it's likely that there are folks around you as well who are also doing the same thing. But just clear your thoughts, reset your thoughts, focus on your breathing, focus on the here and now, that you are okay, right? You're still here, you still have to work, you're still here, you're still breathing, and you'll get through this, okay? The next exercise, and I think this is really important as well on those long days or those call shifts, is to check in with yourself and your physical needs. Remember Maslow's hierarchy of needs, the triangle, right? The bottommost layer of the triangle that everything else is situated on is physical needs. So it's really hard to provide good patient care. It's very hard to learn. It's very hard to do a good job if you are not taking care of your physical needs. Now, are you hungry? Have you eaten today? Have you eaten in the last 4 hours? Do you need some water? Do you need some caffeine? Maybe a coffee or a tea? Do you need maybe a power nap? And again, we don't always have the luxury of having a power nap, but can you even close your eyes for 15 or 30 seconds? Just let your body relax. Just breathe a little bit, right? Another trick that I have not personally done, but I know a lot of people do this, is especially get on those long call shifts, bring a change of shoes or even a change of socks. It can really help you a lot. It can help you feel a lot more refreshed if you change your shoes to something comfortable. Get yourself a clean pair of socks, right? Can you do something just to enhance your physical comfort again? Sometimes it can be helpful to take yourself away from work, even for just 30 seconds. So this is a Pinterest page where I looked up cute fluffy ducklings. For some reason we have a bunny and a puppy here as well. But you can think, on these difficult days or after these difficult encounters when um, emotions are very heavy. Is there something we can do to counter that, right? Is there something that brings you joy? It may not necessarily be looking at these adorable fluffy ducklings. Maybe you're more of a cat person or a dog person. Maybe you like flowers. Maybe you'd like to look at the sports scores. Whatever works for you, what lights you up inside. Is there something you can take even 30 seconds or 60 seconds to do just to bring your brain out of the hospital or out of the clinic and back somewhere that brings you joy, right? Um, Another one that I've used as well is something I call the mantra walk. Now, please correct me in the comments if this has a more technical name. But often, if we're leaving a situation, especially you're leaving a patient room, you're leaving a clinic room, you're leaving a bay in the emergency department, and you're going back to your desk, there's going to be a bit of a walk. And sometimes I personally usually give myself 5 steps, although there's no right or wrong way to do this. And with each of those 5 steps, deliberately tell yourself something, right? It could be, maybe after a resuscitation or a code that didn't go well, I'm safe, I tried my best. um I these sorts of positive talk whatever you need to hear in the moment. Oftentimes, especially if I'm very tired, I'll just say that, I have 5 steps to reorient myself and move on. And with very mindful breathing, I'll go 1, 2, 3, 4, 5, and moving on with my day. Um, you can play around with it, see what works for you. Um, but this is something too that again you can kind of do anywhere, right? In any kind of medical setting, there's going to be opportunities to walk. We're probably going to have to walk. So can you incorporate some kind of self-talk or some kind of debriefing with your walk? Box breathing is also a very common technique. Many of you may have heard about it before. Basically, you visualize a box, and this is a form of deep breathing where you breathe in for a certain number of counts, 2 counts, 4 counts, 8 counts. You hold it for the same number of counts. You breathe out for the same number of counts, and you hold it for the same number of counts. So I might do breathe in 1, 2, 3, 4, hold 2, 3, 4, out 2, 3, 4, hold 2, 3, 4. You do it a few times. Again, just to calm yourself down, just to bring yourself back to the present, regulate your breathing, regulate your emotions so you can move on with your day. Another one I've used, especially on call shifts or um, long ward shifts, is the cold refresh. Now, this always is a bit easier if you're working or living in a cold climate where you're able to go outside, and even if there's snow, touch some snow, walk around a little bit, get that blast of cold air to kind of bring you back to the present. Sometimes hostels can be a little stuffy, so don't underestimate how good it can feel just to get a bit of cold. Now, if you're not able to go outside or you don't live somewhere where it's cold and snowy on the ground, you can still do this. It might just be in the bathroom, maybe running some cold water, maybe splashing it on your hands and your face. Maybe even a cold drink, right? Just to try and bring yourself back to the present, give yourself some sensory stimulation that is a bit different than the stressful ones that you've just been exposed to. And with that, hopefully there's something in there that you can try to do a 60-second reset after those stressful clinical encounters at work. Again, with the reminder that you do have to address those emotions in that situation in more detail, but maybe just not right now.